So, welcome everybody to Clinical Hypnosis Australia. I am Trish Pellin, your host today, and I am talking to Susie. Now, I only got on your website this morning and I was like, wow, we need this. It's freaking amazing. So, Susie is working as a dental concierge. Susie, tell us more about that and how did you decide to get into this?
Thanks, Trish. I'm glad you asked. I guess my journey started when I was about 18 in the dental industry. I It was my chosen career, and my first job, I worked with a root canal specialist. Now we know how painful root canals can become.
Yep.
Um, I was just like fresh out of high school, but I found it rewarding when I was able to help somebody through their journey. And I remember way back then, so many people used to come in with facial swellings and just being excruciating pain. And when you have a root canal, if anybody's ever had one, you'll find that the pain is that bad that nothing can put it to bed or settle it down unless it's treated.
Hmm.
Um, Helping somebody just through that in dental is rewarding.
Hmm.
And then as I continued on in my career, helping anxious patients, especially those who were scared of the needle,
Hmm.
um, injection, or just even the smell of fluoride puts them
Yep.
off.
Yep. That was me before
Um,
hypnosis.
yeah, definitely. I guess there was one patient that we looked after. She was having a crown prep, and I was the dental assistant at that time. And I had such an amazing rapport with her. And this day she says to the dentist, I don't want to have any local anesthetic. And I was like, what? Like, you're nuts. You must. Like, we're going to cut into the tooth, right? It's going to go into the dentine and it's going to be very sensitive. But she said, I do hypnosis, and she was able to transfer any pain that she was experiencing into her feet. And then she went into a meditation, and I asked her at the end of the procedure, how did you do that? And she said, I transferred the pain to me hiking through a forest. And
Hmm.
that was the first experience and awakening I had, like, this stuff's really cool. I
Hmm.
wanted to learn more about it.
Yeah,
Yeah.
the monks of Shokenbuchku do the same thing, where they have been known to cheat death as such when it comes to shifting pain. Hypnosis is amazing.
Oh, even for myself.
Yeah, yeah. And a lot of us also have a lot of transference when it comes to dental stories as such. There's not many of us that go to the dentist and go, "Oh, it was a beautiful experience. We had a tea party." Most of us are in that fear state just at the thought of it, let alone the actual action of it. So how do you help people with those fear states?
Yeah. So, I guess when somebody's coming into a dental practice, I'm not going to just go into, hypnosis straight away unless they want to,
Relax.
do hypnosis with me. I guess I combine a bit of my skill set through the technique as well, having a good understanding of dental,
Mhm.
understanding like the just the sensory acuity of a patient in the dental chair and their color change and everything gives me like the cue to be able to look after them. But there are so many people out there. I guess to go back. What can you just put me back in the picture with that question? I can sometimes get a bit excited, right?
So how are you helping people with this fear?
Okay, so by helping the person, look, it's all through a relaxed state, and
Mhm.
by under like I was just saying, by under having the clinical experience, knowing what the expressions to look out for, or knowing the cues that the patient will give,
Mhm.
um, and it just you just know when to engage. You just know
Yep.
how to deliver and transfer that for them, work
And
with them.
surely a more relaxed dental patient is also a more relaxed dentist and faster healing for the patient as well.
So true. I guess in my time, anxious patients really make it challenging for dentists as well.
Mm.
Um, you've got your different types of dentists. They're all practicing. They all want to do well for the patient. I guess they're dealing with somebody who's awake in the dental chair.
Hmm.
It's not, in some cases, it just depends on the situation. Yeah, you knock them out with general anesthetic and stuff. But when you're in the dental chair dealing with somebody live, it's a lot of pressure in that environment.
And the
Um,
client is very vulnerable as well.
they are they are very vulnerable, and they need to have that reassurance from the dentist. It's all about rapport and the facial expressions. And I guess if that patient's uncomfortable in any way and not relaxed, the dentist does sense that and has to really, really put themselves into a state. So it does work in both ways for relaxation as well, and for the bring the dentist aware to how to manage themselves in those moments to keep
True.
the relaxation in the room and the patient at ease.
Yeah,
And this
absolutely.
is where I think with the dental concierge, sorry to jump in, now I'm on a tangent, right? Well, it's amazing for dental assistants to grow into a different field. They're not just dental assistants. Like you'll find a dental assistant or an auxiliary staff member, they'll be like, oh, I'm just a DA. But they're in that moment too. And I not only have hypnosis clients, but I also teach it just with the level entry and the certification courses. Um, and it's just an amazing tool that I've been able to prove that through my training or whatever it is. And even if I'm in the dental room, I get staff members like, how did you do that? What did you do? It's the best rapport building.
Well,
Um,
even at being the receptionist, they see what goes on when the person's coming into clinic, waiting in clinic, and they can pick up on those cues as well and then relay them to you so you can then help out.
correct, correct.
And you've
Um,
also got a book out there. What makes it all different? It's called The 11 Trade Secrets. Tell us about that.
um, I I needed thank you. So the 11 trade secrets to creating a high performance dental team.
Mhm.
Um, look, without team alignment, team cohesiveness, it creates a different environment for the patient
Yes.
coming to the dentist.
We pick
Dentistry,
up on those looks and cues. Like we notice them. We're just like,
you do. And when you walk into a dental practice and you can just feel the energy if it's off or I guess the thing about my book was I've got so many years of experience. I just wanted to get my message out there.
mhm.
I was very excited to do something different. I at the time it was my voice. And the entry into my next journey in life with my coaching and everything else that I'm doing at the moment. It's also an added credential. It was almost therapeutic in some way. Like all this information went out. Just yeah. So it's really good. And I think for the dental industry and to, colleagues, and I'm very grateful for the journey and the lessons that I've had. And I just wanted to give my great gratitude out, put it out there for
And the
the
times and the technology has changed. Back when I was younger, it was literally just get the job done, stop your sooking, and get on with it. Where nowadays we take the time to actually understand what you're going through. Your technology has changed, even the anesthetics and things like that have changed. So all of our perceptions of what's going on are very outdated.
yeah. And I guess COVID has brought a lot in some way to dentistry. It forced a lot of old habits out that were no longer serving the industry well.
Mhm.
And it's opened up the space for new ways to look after, the people and the clientele that come to a practice. Yeah.
Now, if you could give somebody listening to this one piece of advice about their dental work and hypnotherapy, what would it be?
Um, they would be in total control. They would know exactly what is happening because they're actually managing that. They they go into their own zen. I guess they're going to be able to achieve the need and the help that they need from a dental perspective. I think the next level is, if they're creating a beautiful smile or they're so desperate to have this amazing white teeth these days,
Yes,
this
I think.
big, white smile or a set of veneers, that's a big mental shift. Then they know that there's going to be some sort of discomfort, or they know that there's going to be a period of time to be in a dental chair, so they can feel at complete ease and comfort, knowing that they're in full control with these techniques that they will learn through hypnosis.
Fantastic, fantastic. Well, I can't wait to see you evolve with your next journey, helping out more dental teams so that you can assist people to feel more relaxed in the dental chair and just have an overarching greatness to our industry because we need it. It's as
We
simple as that.
do, we really do. And I'm so grateful for CHA because there's not enough platforms out there that help. Or there's need to be more awareness.
Yeah, we're working on it.
It does, especially with dentists. Like they're a little bit, they think it's a bit foo-foo, in all honesty. And there are some dentists that I have trained with that are very open to it. I think it's been around for a while, we know that, but
Mm.
to actually bring it to fruition and make it available in dental practices, that would be, I think, the next level. Yeah, so I guess if anybody wanted to try hypnosis before going to a dentist, they would need to fill in a referral form, or the dentist would need to refer them first,
Mm. Mhm.
just to be very clear on that, because I can't be the one saying, "Hey, you need hypnosis."
Yeah, we always have to decide it for
We
ourselves.
do, and I just want to make sure it's everybody knows that it's always in a safe space, they're in
Mhm.
full control, and it's always in conjunction with their dental provider.
Absolutely, absolutely.
Yes.
So thank you everybody for listening in. Thank you, Susie, for enlightening us on that, and I look forward to your future journeys. So see you everybody. Bye bye.